So, Kelli, Recovery Works, you're a guide with them. Okay, we thank you for coming out and sharing your time with us tonight. And Jimmie, you're with the Franklin County Public Health, the Community Health and Wellness Supervisor there with that. So what is CHAT? Tell me about that and what it does to help Hilliard.
Yeah, thank you for asking. So CHAT stands for Community Health Action Team, which ultimately kind of sounds like a really bad group of superheroes, so. But essentially, this was an initiative that we started at the health department about 3 years ago. Okay. And when I came into my position there, I started asking around. I started asking, how are we engaging our communities, our cities, our townships, our villages into our initiatives, into our health planning? And the reality is that was an area that we were lacking in. And I once heard a speaker a few years ago say, don't do anything for us without us. And I think that's kind of the philosophy that we've really built this CHAT concept, built into this CHAT concept. So essentially it's a pretty simple idea. You bring together key stakeholders in the community, you bring people together, you start looking at some of the different health needs. So through data, through community wisdom, and then we start trying to figure out strategies, and there's a lot of learning that happens in this, and so start actually trying to put some things in place to address those health needs. And so it was something I was given the go-ahead to do, and since then we've started 5 of these in our communities, and it's been really great to see people have really stepped up. They've engaged in this process, mostly because they get to steer where it goes, so that's been the really exciting thing. And we have some chats who are dealing with things like food insecurity. Mm-hmm. We have some that are dealing with like senior health. And I'm really proud that last year we started our Hilliard Community Health Action Team, and that one has actually been looking at the issue of mental health and how can we do some things and rally some people around that.
We're going to rally tonight because you're on the front lines of it,
yep.
And that's fantastic. You're bringing it to Hilliard for what you do for Franklin County. But Kelli, you've been in that world, in that arena right now, and you have an interesting take on mental health issues because you call them mental wellness challenges, right? Why is that?
Well, I'm with a group. I'm a staff member at Southeast, and I'm in a program called My Recovery Works. Everyone who's in that program is a peer support person. So all us recovery guides, we have mental wellness challenges or addictive behavior or both. And we came up with the term mental wellness challenge. And the reason we preferred that, or what I like about it, is we all have a mental wellness challenge in our lifetime. So whether it's financial, relational, whether it's grief or loss, whether it's a major episode of depression, anxiety, or if you're someone like myself who deals with a chronic mental wellness issue. And so if you look at it that way, that all of us are going to struggle at some point with mental wellness, it connects us all rather than isolate some of us out of the picture. Mm-hmm. So that is why we refer to it in that way.
Well, certainly the words matter. We learned that earlier tonight about how we use our words and some of the words that we choose to use out there. So I think it's wonderful that you attack it that way. Talking about your struggles and talking about recovery and the definition of recovering from a mental wellness challenge, why don't you tell us a little bit more about your story, how you got here?
Okay, I'd be happy to. I think my story is a good example of a recovery from a mental wellness challenge. So I have bipolar disorder. Initially, I didn't know that was what it was. So I kind of started struggling in my late teens. My early 20s, I had my first psychiatric hospitalization. So I was not in a good place at that time. There were more of those throughout the years. And rather than really being persistent and seeking out help, I just tried to muddle through it and do the best I can, try not to bother too many people about it. And in that path of destruction, that I was creating all around me in those years, by the time I got to 2004, I just hit a wall, and I was very depressed. It stayed that way for about 4 years, and in that time, it was so dark and so heavy and so painful that it became difficult to function at all. And I lost quite a large part of my life. So I did take getting help seriously at that point, and so I was persistent in trying to get better, and that's when I got the correct diagnosis of bipolar disorder. But when they gave me that diagnosis, I was also told there is no cure for that, and so it was a very dismal outlook that I was given on where it goes from here, and I really wasn't sure if I wanted to opt into that life, because it was so painful and I didn't think it was getting better, or whether I wanted to opt out. But I stuck with it mainly because there were a few people in my life who it was really important to them that I stick with it. So in around 2007, I did start getting up and taking a walk and making a commitment to take a walk. And people will ask me like how I was able to, what changed that I was able to do that, and I don't know. Sometimes a lot to do with mental wellness challenges is biochemical. I don't really know what gave me the ability to do that, but that stirred up a little bit of spark, a little bit of hope, and a little bit of pride. In 2008, I went to COVA in Clintonville, and I took a class called Wellness Recovery Action Planning. It was created by Mary Ellen Copeland. And it's developing a plan for yourself, a self-directed plan to reach your full potential and to stay as well as much as you can for as long as you can. And you make it yourself. And so I took that, and I had a plan, and I've been using it ever since. And I haven't actually had a hospitalization for 10 years, which is a really long time for me, and I'm pretty happy. So I have a level of peace and joy. And once I started working for Recovery Works, they made it possible for me to get certified to teach Wellness Recovery Action Plan. And so I do that now. I can go out into communities and teach that. So I do feel like I'm in a recovery, and it's going pretty well, and I know that if recovery is possible for myself with all the stuff I've had going on my whole life, it is possible for everyone. And so I'm really here because I want to deliver that hopeful message.
That's a brave step that you've done. Jimmie, as Kelli sits here and shares this story with us so bravely, how common are some of these challenges that you see?
Yeah, unfortunately, they're very common. whether we're talking about anxiety, depression, really anything like that. Even, excuse me, one statistic is, about 19% of Franklin County adults have been told they have some form of depression. It's about 1 out of 5. And, with all these different disorders, these excuse me, illnesses and challenges, we see, really some of the symptoms from that. We look at something like suicides. Every year in our country, there's about 38,000 suicides. That's about 1 every 15 minutes. One of the age groups I really see that is really affected, I think, by this is some of the youth. Suicides is actually the second leading cause of death among individuals aged 10 to 24. So we can see is really affecting our youth and young adults as well. So, and then we also see this persist in some other areas, especially with substance use and abuse, and many people are very aware of the heroin and opioid crisis that we're facing right now. And so, we see some of these things are so connected to mental health challenges, and so we just see the problems steadily increasing.
From your vantage point, and I'm sure Kelli have a thought on it as well, what are the biggest obstacles?
Yeah, sure. I know in some of my dealings with and speaking with people like police and fire department officials, one of the biggest obstacles that they seem to face is really access to care. A lot of times some of the treatment centers may not be able to take the individuals that they're kind of dealing with into there, or maybe the beds are full, or, so there's some capacity issues. And a lot of times for whether it's our professionals or individuals, people don't always know where to turn, so there's an education aspect of that too. They might not know who to call, or how can I refer someone or something like that. So there's sort of a gap in people knowing about services and also utilizing those services as well.
Yeah, and Kelli, did you find those barriers? I mean, when you started, you didn't know where to turn. You didn't know
I didn't try to turn anywhere.
Okay.
So it is a barrier
Yeah.
because there's so much shame connected with mental health issues. And the shame's pretty heavy, and it's of course really unnecessary. Mm-hmm. But in our society, self-sufficiency is really important, and people have an idea that you should be able to take care of these types of things on your own. So I tried to, and so help was sporadic, and then I'd be like, no, I'm okay, and it was really just stigma, the shame, and the idea that I should be self-sufficient, and I really regret not pursuing and staying with a healthy treatment plan earlier.
With the shame, I mean, comes the labeling, right? I mean,
right.
You've been labeled.
Right.
How does that feel?
Labeling feels bad for all of us. Most of us can relate to being labeled for one thing or another, and you'll be going along thinking you're doing a good job, and I'll get to this point where I'm thinking I'm okay, I'm doing a good job, I'm being the authentic me, This is great. And somebody will make an assumption or make a comment based on knowing that I have bipolar disorder, because there's a lot of stereotyping around bipolar disorder. And the rug comes right out from underneath me, and I'm unsteady for a while. I have to re-steady myself. And so it's really, I get why we label, why we tend to want to do that, but it's not helpful in our communities. We all belong to each other. For community to function well, we all have to be able to connect to each other on some level.
From a clinical standpoint, Jimmie, can you say mental health wellness can be cured?
As we talk about how important words are, I wouldn't say cure is the right word. I would definitely, I like talking about more in terms of recovery. There's a lot to that. I mean, it definitely, with the term recovery, you start looking at, it starts recognizing the individual person and the journey that suggests too. And, as I talk to mental health professionals a lot, they talk about how recovery can be something that is very empowering and leads to some autonomy for the person. And ultimately too, with recovery, Kelli alluded to it earlier, that can be different for different people. So, there's no one right way or one prescriptive way that we go about this. So I think, that definitely, it really values the dignity of that person and their path.
And Kelli, you don't like the word cured either, because this is a daily grind. This is a battle for you.
Right. Recovery is a journey, and it's different for everyone. And you have to feel your power, and you have to know you're the expert on yourself, and be involved with the process of how recovery isn't always medication, and it's not always going to the doctor. I mean, it can be walking on Heritage Trail, and it can be going to listen to some music, and it can be learning how to knit, and it can be learning how to meditate, and it can be going to a support group. So you have to find your way, and that's the best way to find your success, at having some peace and having some joy, and losing the shame. And so it's different for everyone, and the word cure, it's talking about that is less of a hopeful conversation.
What is the hope for the future, Jimmie, on this topic?
I think there's a lot of hope, especially as I'm working here in Hilliard with people, there's just such amazing people who want to do something about this. And I think that's the first step, is you have people who are willing to step out and say, we want to address this. And we may not have all the answers right now, but we feel it's important, and we want to take steps to somehow help people in this. And I think, the more we're doing, the more we're talking. One thing I've learned with some of these community health action teams is sometimes we'll have initial questions, and we'll get that, and we'll bring some information, or someone will bring up a point, and it actually doesn't answer the question, it actually raises more questions. So it's an interesting thing that happens, but it's really good because it leads us deeper to getting to the root of some of these issues. So I think especially here in Hilliard, just the people who are stepping up right now, it's pretty amazing.
Are you hopeful for the future, Kelli?
Yeah, I'm really hopeful for
Because
the
you're on the
future.
positive side of things now with your own personal life, and you're a guide. You're helping other people with the same issues.
Yeah, I'm hopeful. I think I know a little bit about, back in the 60s when people with mental wellness challenges were trying to be part of the process, and they had to fight and, try to have equal rights, and they came so far. And and I think about things now, the fact that I'm invited to the Hilliard chats to be part of the process, that I'm here tonight to talk about this and hope, bring hope into the conversation, and that I work with a team of people at Recovery Works that is all peer support, and that SEMSHA, which is the federal arm of mental health and addiction, has said that peer support is one of the 10 recovery principles. So I feel like it's come so far, and we have so far to go, but I'm extremely hopeful.
So I'm going to leave Jimmie with the last word here, because we can all leave here tonight and just go on our way and just think, that's a problem that happens with other folks, and I don't have anybody in my immediate family that deals with it or anything. How can the community help in this?
Yeah.
How can the, just the folks out here at large around Hilliard do something about this?
Yeah, I think number one is educate yourself around the scope of these issues. Certainly, it's extremely helpful because behind some of those numbers are real people, real families, real people who are being affected by this every day, and many of us know some of those people. And so any way that we can educate ourselves more, become more comfortable. One of the things that the Hilliard chat really wants to do is not only educate people, but by doing that, reducing the stigma that is around this. And when I think we can reduce the stigma more, we're more likely to be out there to take those steps to help someone, to refer someone to a program or service. So I would definitely say educate yourself is number one. Two, if anything you've heard tonight, you say, hey, I'd like to become part of the Hilliard chat, we welcome you. That's the great thing about it is it's a very grassroots sort of way of working. So we welcome anyone who feels like they can contribute or wants to contribute. So, get in touch with me after this and I'll get you some more information. And also, even if you don't want to necessarily be part of some of the planning and some of the strategic direction of that, keep in touch. We're going to continue to be putting some things out there, working to educate, having some different programs and events going on. So, just stay in touch.
Certainly we will all leave here tonight and maybe choose our words carefully, around the topic. If you had a motto, it would be lose the shame. So
Right.
Kelli,
Lose
Shoupe,
the shame.
thank you so much for your time.
Sure.
Jimmie Davis, appreciate it very much.
Thank
guys.
you.
All right.
Appreciate it.